we've been getting some interesting feedback from ladies after C-sections, and they're saying that even second time moms, they're saying that this is taking a lot less time to reduce the swelling because they have a significant swelling. It's a very complicated, surgery that has to go through a lot of different tissues. So there is a big inflammatory process, and it generates a lot of pain. So what they're saying is that it takes a lot faster now to reduce the swelling, and also they can stop taking the painkillers even like after a week, which is incredible. Needless to say that low-level light therapy also helps you recover faster and give you more energy. And by the way, there's a lot of interesting studies out there showing the benefits for scarring. So less scarring, and that's what they're saying, less scars, reduced amount of time that it takes for all the swelling to go away, and then reduced pain during the process, which, for a lady that just had a baby is very significant. They're so happy having the baby, but they look down and they see, oh, this is all swollen and everything else. So if you can do, the mental part of it's very, very, very interesting. So we've been getting a lot of interesting feedback for women that went through C-section. So postpartum, women should be using this as well. And that makes you think about it, like menstrual cramps. There is also, I have to report, a lot of interesting studies and reports that, remember, you're increasing circulation to the area, decreasing inflammation, reducing pain. So that's going to be very beneficial for that as well.
Wow, crazy.
So for those women's, problems, I mean, it's a God-given. That's what they're telling us. And then for the men, you think, okay, I have the wives, but I also have my problems, So you may think about testosterone. You may think about infertility. You may think about erectile dysfunction. Those are things that we mentioned a little bit before, but I just happened to take another look at the literature, and I found that, we already knew about the testosterone levels. We have a lot of anecdotal evidence of people that are doing the levels and then using low-level light therapy in the pads in the area, and then they redo the count later on, and they see a big difference. But I found a study that was actually conducted at the University of Siena in Italy in 2016, which was a randomized placebo-controlled trial, and they did it with 38 different men, and they measured their testosterone level and separated them in two different groups. And one of the groups was getting a clinical dose of low-level light therapy, red therapy, light therapy, early in the morning. And after 2 weeks, they measured again. The control group continued the same. And the group that was being treated with low-level light therapy doubled the amount of testosterone, like 2 times more. And then you think, oh, well, this is it works for everything. Well, it works in every cell that has mitochondria. So it works everywhere.